Biden administration is set to announce the first 10 prescription drugs targeted for price negotiations by Medicare. It's going to happen this morning. Join us to talk about the potential impact on pharma companies, Mizuho Securities Healthcare Sector Specialist Jared Holz. And we had former FDA Commissioner Scott Gottlieb, Dr. Scott Gottlieb, on yesterday talking about this. He was not that pleased with the actual mechanism of what's the way that they're actually doing it and some of the unintended consequences. Jared, do you have those concerns?
Thanks for having me, Joe. I appreciate it. Yeah, I think there are a lot of dynamics here. We can argue positive and negative for the industry and how the government is going about doing this. I think at the end of the day, it's a little bit of a political, symbol on the part of this administration in order to, curb drug pricing for seniors. Many of these drugs are going to be for the 55 and older community. It's a strategy I think they employed in order to, help their, chances with the election coming up. And we'll see how it all plays out. But, it's very, very difficult for the companies to kind of navigate around it. We'll see what the negotiations are and how this kind of goes over the next year. The companies are going to have about a year to kind of counteract or argue their case against CMS regarding the drugs that are going to be announced later today, as you mentioned. So we'll see how it plays out. But I agreed with, most of what Scott said yesterday.
It was very complex, and it had to do with the differing effects on small molecule development versus different drug development. Scott said that the patent structure is really at issue here, and if you wanted to try to modify that to get to certain goals, that would have been a more effective way to do it. But you're a little bit cynical. I think maybe I am too. That I keep hearing the president talk about it as just a slam dunk. Look, it's part of the IRA. We're going to lower drug prices, and the election's coming up, so that all makes sense. But the devil's really in the details. If it actually ends up making things worse in terms of being able to getting access and innovation and everything else. Can you go into that?
Yeah, well, certainly. I feel like if drug pricing is curbed or curtailed to 20-30%, even greater, and we're basically undercutting the patent life of some of these drugs by anywhere between 2 and 5 years. It really depends on the specific drug we're talking about, and that's obviously detail oriented, as you mentioned. It presents a lot of complexity for companies in order to how are they going to salvage the business from an investment perspective? What are they going to do with R&D, and how are they going to develop drugs? If we keep on pressuring revenue and earnings, it's more difficult to come up with new and better treatments. So in some ways, like you create a dynamic in which you make it more difficult for the industry to get better medicines to patients. So is it counterproductive from that standpoint? I think you can definitely make the argument that it is. I think that's what Dr. Gottlieb mentioned yesterday. And I think that's what the companies are also saying as part of, these lawsuits that Bristol Myers filed and Merck filed and a couple others, basically saying, talking about the unconstitutionality of this IRA in general and what it means and the impact on the business. So no doubt about it.
I mean, if you were a genius and you knew exactly how to do it, on face value, it's logical. Medicare is a huge buyer. They got any other industry, you'd see someone with that type of clout be able to negotiate better prices. But then you've got, it's so complex in pharmaceuticals. You've got the middlemen and the lists and the CVS and the mail order pharmacies. And you got all these different, you don't know where the real increases are coming from. You don't know if the bad actors are the
benefits managers.
At PBMs, you don't know whether it's the drug companies that are the bad actors or they're all bad actors. And it's just such a big target. So let me ask you this. Okay, here's the potential ones. I'm just wondering whether I can sing the song of any of these. I don't see Zempic or Tesla. They all have songs now, and they're all advertised on nightly news. Let me see.
Yep.
Enbrel, that's a huge one. Eliquis, I've seen that advertised. Symbicort, Jardiance is a big one. Januvia. So I've heard of some of those. I couldn't tell you what many of them do. Is that your list, Jared? Or does that look right to you?
Yeah, I mean, that's roughly the list. Eliquis is the big one. There's a couple big blood thinners on here.
Blood thinners.
Xarelto is another one. You've got several diabetes drugs. You've got a few oncology drugs. We don't exactly know what the list is going to be. That sounds roughly right. We've all tried to kind of run through, what the top 10 drugs might be, what companies are impacted. When I look at it, it looks like Bristol, Merck, J&J, Pfizer, AbbVie seem to be potentially the top 5 impacted.
These, Jared? What's the rationale? And then there's 10 more coming a year from now or something?
There's 10 more coming a year from now. This is all going to kick it in 2026. So we've got a couple years before this, actually becomes implemented, but we're already seeing pharma work around it. I mean, Pfizer's done 6 acquisitions, or they're attempting to, do their 6th acquisition in less than 2 years with Seagen, which is a $43 billion deal. Amgen is trying to lock up Horizon for about $28 billion.
Right.
So a lot of M&A is taking place.
Probably. Partly in response to some of this. All right.
But do you buy the stocks or sell them as a result?
Yeah. I don't know. Would you make a decision on the names themselves about whether to hold on to them or buy them?
I mean, I feel like we've been in kind of like a holding pattern waiting for the top 10 for almost a year now since the IRA came out. So I feel like if the stocks, dip another, 3 to 5% just on the headline, I think I would buy it for a trade. I'm not sure about much more than that.